Dr. Anushka Patchava, the Deputy Chief Medical Officer at Vitality. Clinically Speaking is our monthly series where we come to our advisors to share short videos on clinical topics, new clinical trends, clinical updates, and expert opinions. Today, we have a fantastic new episode available for you. This episode focuses on the trends that are happening in the future and very much aligns to the theme of the future of health insurance now. I am joined by two fantastic panelists, both co-founders of new upcoming digital health apps. Jo Aggarwal is the co-founder of Wysa, a market-leading mental health and mental well-being app, and Dr. Krishna Moorthy is the founder of OnkoHealth, equally a very well-established cancer treatment app. Jo, I'll hand over to you to introduce yourself.
Hi, I'm Jo. I'm one of the founders of Wysa. Started building Wysa because I went through depression myself and wanted something where I could help myself. I learned cognitive behavioral therapy and felt it could be done a lot easier. So Wysa is an AI platform, conversational platform, where anonymously you can talk through your issues and walk through some of the CBT exercises and techniques that a therapist would help you, but it would also detect if you need more help and connect you with a real therapist.
Fantastic. Thanks, Jo. Great to have you with us. And Krishna, if I can come to you next.
Hi. So, my name is Krishna, and I'm a cancer surgeon. I work at Imperial College London, and I'm also the founder of OnkoHealth. This is a digital solution providing support and health optimization programs for people undergoing cancer treatment. Onco is very much born from my personal experience in looking after cancer patients and witnessing the devastation caused by cancer on people and their families. And over time, realizing that we have to place health at par with treatment if we want to effectively deliver treatment to patients.
Thank you, Krishna. Also great to have you with us. Together today in our series, we will be exploring the impact of COVID-19 on both mental health and cancer services, and also thinking about the future, understanding the new trends that we've seen as a result of the pandemic, what we expect to happen in this space. So, to kick us off, Krishna, Jo, in respects to what you're seeing in both cancer and mental health space, what would you say are the recent trends and behaviours? Krishna, over to you first.
Well, the pandemic has had a significant impact on cancer, and it's caused a parallel crisis in cancer. We've all been reading reports about how drastically there have been changing trends in diagnosis, access to services, access to treatment. Hospitals have practically sometimes shut down their diagnostic services, especially during the first surge that led to delayed diagnosis. People have been isolating at home, which has had a significant impact on their health. They're presenting later as well. But having said that, I think if at all you can say that there's a positive, that positive has been the ready adoption of technology by both clinicians, who are generally seen to be reluctant dinosaurs in the adoption of any technology, but more importantly, even patients. And what's really interesting is that the profile of patients who undergo cancer are generally elderly, and they're the ones who are considered to be not so savvy with technology. But at least in our own personal experience, we're seeing that that's not the case. Nearly 70 to 75% of patients are very happy using digital technology.
Fantastic. And we'll come on to technology in a second. But before we do, Jo, from what Krishna's saying, are the trends in mental health been similar or different? Could you shed some light on that?
Well, what we've had with the pandemic is what's also called a mass trauma event. So we've had the whole world go through trauma of something very drastic hitting them, changing their lifestyle, changing their options across all age groups. We've had people dealing with financial difficulties. We've had people moving back to live in with their parents and having relationship issues. We've had families that are bringing up children between two families, not being able to meet, children being separated from their parents. So a lot of social factors that have contributed to an increase in mental health issues. I think broadly anxiety has been through the roof. So there's been a 20 to 30% more diagnosis of depression and anxiety at primary health care than there used to be pre-pandemic. But the big thing that I've seen is that before the pandemic, everybody used to talk about 1 in 4 people will deal with mental health issues at some point in their life. Post-pandemic, that conversation has stopped. We've all realized that mental health is something that we all need. And there has been a lot less stigma, even in countries like India, where employers wouldn't even talk about it or deal with it, or across the world, both employers as well as payers, as well as individuals, it's just risen to the top of the agenda for everybody. And there's no stigma around, as a positive, around saying that you need mental health support today.
That's really interesting, Jo. And I reflect back on your statistic around mental health being 1 in 4, and equally for cancer, I think we hear 1 in 2 or 1 in 3 people will struggle with cancer. And it seems that the pandemic has not only potentially made both of those statistics a lot more prominent in society, but also raised the awareness, which I think is the positive piece you were reflecting on, Jo. And equally, we know that employers that we work with at Vitality and employers across the globe have really started to consider healthcare and the healthcare benefits they offer their employees as critical and almost essential to attracting the right talent and preventing attrition in their roles. So both of you touched on technology, which is unsurprising given that you're both founders of digital health companies. I'd love to explore that a little bit more. And I guess my question to both of you is, what role can technology really play in the delivery of cancer and mental health services now, and potentially also in the future? How do you see that playing out? Jo, let me come to you first.
I think I'll build upon what Krishna mentioned, which is treatment versus health. And when you want to move any kind of care from treatment to health, you have to look at a kind of support that is available at home, is non-intrusive, is helping people through the day, is more like a gym than a physiotherapist, and empowers them to take care of themselves. And that's something that you then look for access mechanisms that are always with people, that are non-intrusive. And I think we all end up with a mobile phone or as being the way in which you can help people manage their own health. So from a mental health perspective, it's having a companion at 2 a.m. That scales like, for us, we look at Wysa as something that scales like a product, but listens like a person. And there is no getting away from listening to your story and your narrative of how you're feeling and talking it through it in terms of helping somebody with their mental health. But by making it the listener an AI companion, and that therapists have trained to talk, you can make it scale, and you can make it very personal. People can open up much more easily. People can use it at 2 a.m., 3 a.m. if they need to. So it really goes into the sphere of health and away from the sphere of treatment. But ideally, technology also identifies those people who need treatment early, so that that treatment can get to them early when they need, and help them identify the options that they have as well.
Thank you, Jo. That's great. And for our listeners who are listening who might not know Wysa as well as yourself and myself, do you want to just share with us what you mentioned around the AI-driven 2 a.m. friend piece?
Absolutely. So Wysa is a penguin that sits on your phone, and people have said that it's more human than most people when they talk to about their mental health. But it's helped over 3 million people deal with mental health issues globally. It's used in 65 countries. and people talk through whatever they're dealing with, and it will use evidence-based techniques and guide them through that. And if people want, they can also add a real therapist that they can talk to on the same platform, still anonymously. Or if they're in crisis, it can guide them to the nearest crisis line or other forms of support they might need.
Fantastic. So it seems like a partner when you're going through the challenging times, either with mental well-being or mental health.
Absolutely.
Great. Thank you, Jo. Let me come to you next, Krishna. I guess with cancer and a lot of cancer services predominantly being physical in the past, how and what role can technology play in blending in digital with those physical cancer environments that we know so traditionally have been used in healthcare systems?
That's so true, right, Jo? And I think this is a journey that I think we are going to have to go on, and to move away from that traditional approach whereby cancer services have to be provided within hospital settings. And we have to find alternate ways of providing that level of support that cancer patient needs. Now, technology is going to impact on cancer in so many ways over the coming decades. And AI, to a large extent, is now being used for delivering precision cancer treatment or personalized cancer treatments. But I think there's a greater potential to actually personalize entire cancer pathways to the individual, and move away from this one-size-fits-all approach that we now adopt for cancer treatment and cancer care. The brilliant thing about technology is that there's so much that a cancer specialist does that takes up their time. It's mainly on admin tasks, scheduling, and it's on collecting data and then understanding the data. And technology allows us to surface so much of data and analyze it and present it in a manner that makes the interaction between the clinician and the patient so much more efficient, but also so much more rewarding to the clinician as well. And by adopting this scalable, efficient approach, that clinician can probably deliver more care to more people than they do right now. Also, we in cancer have a very schedule-based service. So you make an appointment, you see an oncologist, or you see your nurse specialist or your physiotherapist. While there's someone at home who actually needs your care at that moment, but doesn't get it because their appointment is a week or two away. So we move away through remote monitoring and from patient-reported outcomes through digital solutions. You move away from an approach where everything is scheduled to providing needs-based targeted interventions to people who need it most when they need it most. Now, having worked with cancer patients for so many years and having delivered our service to nearly over 100 and more patients, what we feel is that the human element is important in cancer care, especially when you're going through a very difficult time and when the whole landscape of cancer care, cancer treatment, and its impact psychologically and physically is quite significant. But then we can deliver it in such a way that it's most effective and efficient, and people will access it when they need it. And I think that sweet spot between human and machine is what I think we're looking for in my solution for sure, but probably even in the world. How you blend that human and machine element is going to be so important going forwards.
Fantastic. Yes, and we've talked about in various themes across the years around digital and that physical digital service blend that you refer to, and I think that plays very much into how do you blend machine and human and not lose the human aspects of care in the future, the empathy and the personal aspects that we've grown to know and cherish within the healthcare system. I wanted to ask both of you a challenging question next. So you talk about digital shaping the future of healthcare. If I gave you the pen or the artist's license to design a hospital of the future, what are the 3 key elements you would put into that system? Jo, let me come to you.
Well, not having designed hospitals or worked in those, I would let me take a stab at this anyway. For me, the concept of a hospital is still treatment today, and I would say healthcare of the future. I would design something which was a continuum of care between people being able to have a quantified self where they know how their metrics are. They have much of an insight of personalized both medicine and diet and physical activity, what works for them, what doesn't. That then leads to early intervention and support. I do not have a view on whether the actual hospital component of it would be redesigned in any way. I think you guys have worked in that setting much more, and I'd rely on you for that guidance.
Thanks, Jo. So I guess that's a great segue for me to go to Krishna, who is a practicing clinician in the NHS. How would you design the hospital of the future, Krishna?
Well, I think the first thing I would do is probably less hospital and more, home, because I think we can do that today. Hospital-based care, we know, is very expensive, and cancer treatment costs are going to break the healthcare system if we're not careful. And so being able to deliver care at home to people in their convenience of their own homes with their family around them is going to be really important. And, there's so many other drivers for this, travel costs, trying to, save the planet from that perspective. It's shocking that we'd realize that billions of dollars a year are not just spent on direct cancer treatment costs, but they're the softer costs of people taking time off work to go and take their loved ones to hospital appointments. So if we are imaginative and if we are bold and ambitious, I'm sure there's so much that we deliver in hospitals that can be delivered at home. Number one. Number two is leveraging technology to provide more collaborative, and I won't even say multidisciplinary care, because that still is siloed care in many ways. I would talk about transdisciplinary care, where everybody has access to the same information about the patient. And the patient then, in our programs, the one thing that consistently comes across and the feedback that we get from our patients is that they appreciate the fact that everybody they speak to knows exactly what's going on, in relation to their health and their progress. And they don't have to keep repeating information constantly, because that's one thing that really breaks trust in the system. And what you need when you're undergoing cancer care is trust in the system. And that collaborative environment of providing unified, integrated care, which is what we stand for, is, I think, another way by which you can revolutionize cancer treatment that's being provided in hospitals. So I think these are the two main drivers and two main ways in which technology will help. Take it out of the hospital as much as possible and provide that collaborative care that patients want and desire.
Fantastic. Thank you, Krishna, for sharing that. I definitely agree. We ourselves at Vitality have seen a huge increase in the number of members who are opting for at-home treatments, be that in chemotherapy and or digital physiotherapy and or other services like the utilization of digital GP services in our VGP service. So we can see those trends playing out right now with our own membership. I guess that leads me on to my final few questions. My final few question is around, what do you see as the future of healthcare delivery in mental health and cancer, respectively? And then what do you see as the future of Wysa and OnkoHealth, respectively? Let's start with OnkoHealth first. So what do you see as the future of healthcare delivery in cancer, Krishna? And what is the future for Onko?
This is something that really excites me. I think the most important thing is that technology in every which way is going to play a very fundamental role in cancer treatment and cancer services. And there's growing evidence of the impact of concepts such as prehabilitation and rehabilitation in improving the quality of life and recovery of people with cancer. And I envision a world where everyone who's diagnosed with cancer will have access to solutions and services such as Onko that will help them and support them and guide them as they're undergoing cancer treatment. Decision-making in cancer is going to be more data-driven rather than just having treatment protocols. I think whole pathways are going to be personalized to the individual using technology. And hopefully, care that is today slightly ad hoc, reactionary, siloed, and fragmented will become more personalized, proactive, and integrated. And I definitely hope that technology will be accessible to everybody. But having said that, I also hope that as healthcare systems, we will make every effort to make sure that we don't exclude people because of the digital divide. And so while we get all excited about digital technology, we must accept that there will still always be a small minority of people, and hopefully that will diminish with every passing generation, who may not have access to these innovations. And it's in our responsibility to make sure that we do something to ensure equitable access. And in terms of Onco, well, our vision is that we use a scalable approach using our technology. We're already bringing some automation into it. We're going to be bringing AI into it. And by doing that, as I said, we do strongly believe that some level of support and guidance is essential, but not for everybody. But we do need to be able to, very accurately predict who does and who doesn't. And for the people who don't need that one-to-one support, they still should have the security and the knowledge that someone is watching out for them. So, using all the benefits that technology can offer, I hope there'll be a day one day when OnkoHealth or programs such as OnkoHealth will be available to all cancer patients while they're undergoing treatment and recovering from treatment.
Thank you, Krishna. So Jo, let me come to you next. What do you see as the future of healthcare delivery in mental health and for Wysa as a business?
I can take an example of what we're doing with the NHS as how healthcare delivery is changing in mental health. So NHS right now, 2/3 of the people who self-refer or are referred by GPs into mental health service are told that they are not, that they don't meet the diagnosis criteria to receive therapy. So right now, talk about the future, we have to talk about where we are today. We have an ever increasing number of people who are relating to their distress in psychological terms rather than social or economic terms. That's just the phase of sociology that we're in. So we will say that I'm depressed rather than I'm distressed. And therefore, there will be a lot of people coming into the healthcare system looking for mental health support, but not meeting the diagnosis criteria for mental health. However, when they're not given enough support, they will decompensate into a situation where they will need clinical support. So today, healthcare just gates them out, sends them off with a workbook or a website link. What we are hoping to do is use AI to actually get everybody who feels like they want to manage their own mental health to be able to have access to something that scales, like Wysa, so an AI-based, evidence-based protocol that people can use to help themselves, that will also see when somebody needs extra help or somebody is actually not able to help themselves, and then therefore use therapists and psychologists and psychiatrists where they are best used. And I see that continuum of care also post, for instance, inpatient care or psychiatric care, to give people the tools to be able to manage their own mental health. And the future of mental health is really about that shift in mindset, which is happening in healthcare across the world, from saying that mental health happens when somebody sees their doctor, to mental health happens in what they do in their own head and their own behaviors in their own lives, and supporting them in doing that. And Wysa is, for us, we've just won the NHS's largest award ever to an AI platform for mental health to trial this whole protocol I just described to you within one of the NHS trusts. And we're working with the Imperial College with that, and trying to publish the kind of evidence that would actually get healthcare systems across the world to change their protocols. So that with that kind of evidence, where you can see both the health economics report as well as what it does to people with both mild to moderate, but also moderate to severe depression and anxiety, when they have this kind of a care protocol, we're hoping that we will be a part of that solution.
How very exciting. Thank you both for sharing your insights, your experience, and also the innovation you've brought to both cancer and mental health services. It's been a delight to listen to your ideas, and I'm sure our audience has really taken away a lot of information from what you've shared today. Before we end then, I'd like to ask you one more challenging question. If I could say you have one word, how would you describe the future of healthcare and the future of health insurance? Krishna, over to you first.
Well, Nush, to me, it's been an eye opener what's happened in the past decade, and we've got to rein in healthcare costs, otherwise it's going to get out of hand. And one of the ways in which cancer treatments are getting so much more expensive now. Newer and newer molecules are coming on the market, and they all cost something like $8,000 to $10,000 per month for treatment. We've got to rein in costs, but that doesn't mean we deprive people of treatment. What we do, I think, is make them more effective. I think that's what we need to do. And one way of doing that is, someone very wisely said to me, and even though I'm a surgeon, I'll say it, I think patient engagement is the blockbuster drug of the 21st century. If we get patient engagement and patient empowerment, and we get them to buy into their own health, then I think we will definitely save costs. And that's why I find insurance companies, if I may say so, like Vitality, so much in the cutting edge of helping provide healthcare, because I know you incentivize people to look after their own health. And I think that's exactly what we need to do, is to use various behavior change techniques to educate people to look after their own health, maintain their own health. And by just doing that, we will see a significant reduction in costs. I'll give you an example. Through our own research, we found that 30% of people undergoing complex cancer surgery experience postoperative complications. 30%, but about 20% of that, or a fifth of that, can be avoided by just optimizing the health of people. We can reduce hospital stay. And by doing that across the globe, I think we can easily save something like $500 million by just doing that. And I think that is the opportunity for us to save healthcare costs, and not just by depriving people of what could be cutting edge treatments. So to me, patient engagement, patient empowerment, and giving them back control is the future of healthcare.
Fantastic. Thank you for sharing, Krishna. And less days in hospital is a delight to hear for everyone, I'm sure. And Jo, over to you. So what would you say was your one word or your one kind of sentence that encapsulates what you think the future of health insurance and healthcare is? Krishna mentioned patient engagement and patient empowerment. What are your thoughts, Jo?
I would say, I'm a little biased here, but I would say mental health is the future of all health. Because I'm seeing doctors across specializations, whether it's chronic conditions or pain or cancer or even fertility and gynac. The number one predictor tends to be how the patient himself or herself behaves. And the psychological aspect of that has for too long been siloed. And if we can bring in mental health into all treatments, I do believe we will change the cost function, like Krishna talked about.
Thanks, Jo. A really interesting insight. And at Vitality, we also take the importance of mental health that you mentioned and put it into our services and our products. And our members have access to the Talking Therapies benefit, for example, that gives them direct access without needing to see their GP to qualified professionals. Who can then treat them either using therapies like you've mentioned, Jo, CBT, and or anything else that they see of benefit to those members. It's been really delightful to talk to both of you today. Thank you, Krishna and Jo, for your time. Thank you for founding the digital health apps that you have done and for sharing your stories with our audience. This has been our episode of Clinically Speaking, the future of health insurance now. Thank you for your time. As a reminder, these episodes are uploaded once a month on our Vitality Advisor site. We look forward to welcoming you in the future.